Hello and welcome to the PT on Ice Daily Show. My name is Trissa Hutchinson, Doctor of Occupational Therapy, and today I'm here to talk to you about a case study of mine, a patient with chronic lower extremity pain. So with this patient, we're going to dive in and talk about some mistakes that I used to make in the past as a new grad coming out of school, thinking I was on top of the world and knew all of the tips and tricks to help this patient, when in fact I was making some big mistakes. We're going to dive in and talk about the process, where I started with this patient, gathering helpful information, progressing towards how do I introduce exercise and begin my interventions? How do we level up our interventions and introduce that progressive overload? And then how is the patient doing now? So let's dive in. The patient I'm talking about, we're going to call her D. She was referred to me for, again, chronic lower extremity pain after having a fall out of bed. Now, Dee spent some time in the transitional care. We learned that she had compression fractures in her back, but they were old. Nothing was acute. Dee also has a chronic fear of movement after her fall, but no other really crazy diagnosis. She has some struggles in terms of macular degeneration, but as far as like functional mobility, movement, she's doing pretty well. Now, when I went in to evaluate Dee, Dee was sitting in her recliner. She didn't look very good. She was not dressed well. We would say maybe like disheveled. That sounds like a harsh word, but that's the truth. Her hair wasn't brushed. I could tell she hadn't taken a shower in a while. But just wasn't looking like she was having her best day. So when I went in, I had to be mindful of when I was asking her questions, explaining to her that I just am here to gather some information, just want to learn about you, and then really make sure that she started to build trust in me that I was going to help her get better. So some helpful information that I gathered. Dee was the primary caregiver for her husband of over 74, almost 75 years with dementia. Now, her husband recently experienced a decline in his cognition. And while she was in the transitional care, her family had to move him to another facility. So he was no longer living with her. And prior to her fall, he was living with her in the same apartment. So Dee was struggling with feeling some loneliness, also feeling some sense of loss in the sense of caring for her husband. And then because of her fall, he wasn't able to stay with her. So I had to really make sure to spend some time listening to her and, providing that sense of comfort in a response to that horrible, sad situation. I will mention that as we progressed through our plan of care, her husband did pass away. And so I had to be really mindful of that when we were implementing interventions as well. Some other lifestyle factors. Dee used to be extremely active, was really, really proud of her physical abilities, super independent. Prior to her fall, was 100% independent with a four-wheeled walker. Other than that, had no support, was doing her own finances, all of that good stuff. And now was contact guard assist to min assist for all occupations and had stopped moving. When I was gathering a sense of Dee and her understanding of just where she was at, she told me that she cannot move or it will hurt. She told me that she just needs to wait for the pain clinic, but her appointment for the pain clinic wasn't for another 4 to 6 weeks at the earliest. So for 4 to 6 weeks, she was hoping she could just not move and get better. She has a family that is super supportive. So that was a really big positive, a win for Dee. Daughters who come to visit quite frequently. And they shared with me that Dee had lost a lot of weight and only was weighing 96 pounds. Dee, prior to her fall, was almost 110 pounds. So she lost a ton of weight after the fall. She stopped moving. She lost her appetite. And then again, as I mentioned, she had the whole situation with her husband declining and then eventually actually passing away during our plan of care as well. So that's some background history on Dee. One thing I want to mention is I also asked her about her health habits. And she had shared that along with her loss of appetite, she has always struggled with her hydration. So was not drinking a lot of water, not drinking a lot of fluids at all either. Also, getting off of her chair and walking to the fridge or walking to the kitchen to grab a cup was a no-go for her. So that was another factor. Last big, huge factor here was that in the environment, I noticed she had a giant piece of paper taped to the wall that said bend, lift, twist. No, with three giant underlines underneath of it. So she had an added fear of movement because she was told over and over and over, no bending, no lifting, no twisting. I will say we did a chart review and there was no precautions. There was nothing added. And again, we know that precautions aren't exactly helpful in the first place, but now she had precautions that weren't actually even correlated to her plastered on her wall. I'm not sure where they came from. They weren't from family. We assume were from someone at the transitional care, but now she's already afraid of movement and she has even more fear of movement. Okay, so now you have a full picture of her background of where she started at. So this was daunting. I will say, when I first started as an OT, I would have been really nervous. I would have spent the majority of my time listening to those words written on the wall, regardless that they weren't in her chart. I probably would have gotten her a reacher. I probably would have tried to raise everything up. I probably would have tried to teach her how to do her things without bending, without lifting, without twisting. I might have consulted about more pain medication. I might have just try to add more services without any intentional focus on getting this patient moving. I may have addressed things like hydration, but honestly, team, I probably would have spent the majority of my time adapting and modifying and making the mistake of encouraging those nocebos, those fearful words towards movement. Now, after I've taken our older adult course track, specifically when we talk about like the live track and how we can intentionally underdose, which is what I'm just going to introduce to you, that made a huge difference. When I approached this patient, I had a better plan in place for how to get her moving. So where did we start with our intervention sessions? We took some time to build rapport. I asked her how she was doing. I asked her about the funeral plans. I listened to her while I asked her if I could move her legs for her. I would express to her that I know you're in 8 out of 10 pain, but if I move your legs, you don't have to work your muscles at all. So I would let her sit in her chair and I would literally just bend her knees back and forth. I would help lift her arms, all of that good stuff. So we're talking extremely intentional underdosage, meaning we're starting extremely light, just trying to decrease her fear of movement. From there, I would buy in a little bit and I would notice she started to trust me. So we progressed to seated exercise where she would do some marching in place or kick her legs out straight. So like an unweighted longer quad or shorter quad. We would just do some seated hip hinge. So I would never say bend. I would say hinge. So she'd lean forward and touch her toes. From there, I was able to get her to buy in a little bit more. And we would walk from her chair just in the hallway of her apartment and back. So about 20 feet. All the while, I was doing education with her. During our recovery breaks, I would make sure I handed her a glass of water. I gave her the analogy of how our muscles can be like sponges. And if the sponge has water, it can move really freely. And if a sponge is dried out, it's pretty crusty and doesn't move really well. And she started to buy in even more. Suddenly I noticed she was drinking more water. Her daughters were helping with this as well because they were listening to the things I was telling her. From here, she started to have a decreased fear of movement and increased trust with me because we started slow and we started small. We then progressed to a 3-pound dumbbell. Now, I knew that Dee could handle way more than that, but we started light again and then gradually progressed. We did things pretty consistently so that she was familiar with what was about to come in session. We would do a set of 5 to 8 sit to stands. Then we would go ahead and do a standing curl and press with a crushed grip on that dumbbell. And then we would do a deadlift into a row. It started as a deadlift, but she wanted to add the row, so we went with it. From there, we also added in a walk in the hallway with that 3-pound dumbbell. Each session following, I added 1 pound. So we went literally 3, 4, 5 until I could jump to an 8, 9, 10. And then I was able to jump to a 15-pound dumbbell with her. She is now able to put a 15-pound dumbbell on her walker, walk for about 350 feet. She does deadlifts to a row. We say hip hinge instead of bend because she's afraid of the word bend, but that's getting much better. She can curl that. We struggle a little bit with the press, but she still works her magic. And then she also is still doing those sit to stands. So we started out sitting down, passive range of motion, me moving her legs for her. We then progressed to just seated exercises with no weight. We introduced a dumbbell at 3 pounds, and then over time, slowly but surely went up a pound at a time. So we just took it slow, but we increased her overall capacity over a broad span of time. But now, here's what I want to share. This is the most magical part of it all. When I showed up to one of our last sessions, Dee looked at me and she said, "Man, my leg barely ever hurts anymore. But this morning I woke up and I was pretty sore." So I just said, "You know what? I got to get moving." And Dee got up, went for a walk in the hallway, came back and said her leg pain was 100% gone. She said, "I remember what you said about the sponge and how I need to drink more water. So I went and got myself a glass of water and I'm feeling just great now." Her goals went from, can I just get to the pain clinic, to this last session. She was telling me she can't wait for her daughter to get back from Arizona because she said that she's asking her to bring her to the casino because she wants to go gambling. Her grandson has a wedding in 2 months and she's working her tail off because she wants to go to the wedding. She feels like she finally has her life back. She said, "I'm going to ask if my son-in-law will let me get in the pickup truck myself instead of him lifting me up and putting me in there." She has now learned that if we start small and we just move, we drink our water, we are intentionally get up and participate in physical activity, we can feel so much better. She still has an appointment with the pain clinic, but she mentioned to me she's not sure she even needs to go because right now her pain is managed. So everyone, it is incredibly important to make sure that we are reflecting on our overall practice. I made the mistake in the past where I would just adapt, modify. I was afraid of what to do with a patient like this. I took the time to learn, to educate myself, taking these awesome courses so that I now am super confident that when I get a patient like this, I can make a huge difference in their life. Dee went from, I can't do anything, I have no hope at all, to dreaming and making goals that are high level and things she's wanted to do for her whole life. Thank you so much for tuning in today. I hope that this is really helpful and gives you an opportunity to reflect on the things maybe you used to do or maybe you're doing now that you could take some classes and get better and make a bigger difference in your patients' lives going forward. Thanks so much. Have a great day.